everyone, I am Jam Chelsea Faye M. Velarde, a first-year nursing student of Davao Doctors College. Well, this video is all about health assessment interview and general survey. But before we start, let me share to you the concepts and purposes of doing a nursing interview. First one, it provides the database from which all other phases of the nursing process will flow. The second one, observation of process, both verbal and non-verbal, provides information about the patient as a person. The third one, it enables nurses to understand the patient's adaptive processes. The fourth one, it enables nurses to spend more time to connect, to interact with their patient, as well as to understand their patient's needs. And lastly, it assists nurses to establish a unique perspective regarding the meaning of the patient's illness, beliefs, and preferences of patients or families. And those are the concepts and purposes of nursing interview. Now, since this is the first time for my patient to get an interview about her illness, let's expect her to be too shy or to feel uneasy throughout the interview. In this video, I will going to perform the comprehensive health assessment. And the type of assessment that I will use are the observation,
Nag-exercise po ako kasi nagda-diet po ako.
palpation, the auscultation, and the inquiry.
So how long do you use your phone, Miss Kaina?
Now, allow me to introduce to you the things that I will need in conducting my assessment. The first one is the comprehensive health assessment form. This is the thing that I will need to take note about all the information that I can get from my patient. And next, the BP apparatus, of course. Next is the stethoscope, the thermometer, and, of course, the alcohol. It is very important to sanitize our hands before we introduce ourselves to our patient. Now that we're all set, let us now proceed to the interview.
Good afternoon po, ma'am. I am Nurse Chelsea and I am going to assess you today, okay po? May I know your name, ma'am?
Binis Amrenales po.
Ines Amrenales. How young po?
16.
16. Single tayo, ma'am?
Apo.
What do you want me to call you po?
Kaina.
Miss Kaina. Okay, so I'm during this interview, I will going to take note all the important information I will get from you, okay? Okay. All the questions that I will ask you are just so simple, so you don't need to worry, okay, ma'am? Okay. So what is the language you prefer to use during the interview?
Tagalog or English po.
Okay. Do you have any clarification, questions, or concerns before we start this interview?
No.
Okay, no. Before we begin the interview, do you feel cold or do I need to adjust the air conditioner?
No.
Okay, so you're good. May I ask what you are feeling right now, Miss Kaina?
Masakit po yung ulo ko.
Masakit. Okay. Kailan pa po nag-start?
2 days ago po.
2 days ago. Okay. Pwede nyo po bang i-rate yung pain na nararamdaman niyo, ma'am, from 10 being the worst possible pain and 1 being the least?
7 to 8 po.
7 to 8. What does the headache feel like, ma'am?
Kumikirot po siya, ma'am.
Kumikirot. Okay. How long does it last?
Mga 10 to 20 minutes po.
Oh, medyo matagal din, ma'am, no? So, where does it often occur po?
Dito po hanggang dito.
Sa middle part. In previous month, had you experienced the same kind of pain?
Apo.
Opo. What did you do to lessen the pain?
umiinom lang po ako ng gamot.
Okay, so what do you think is the reason of your headache?
Kasi nagbabasa po ako kahit madilim at babad po ako sa gadget.
Okay, so how long do you use your phone, Miss Kaina?
Mga 5 to 8 hours po.
May I ask how long do you sleep every day?
Medyo kulang talaga. Hindi na abot ng 6 hours.
Oh, medyo kulang nga. Are you able to perform your daily regimen?
Opo, nag-exercise po ako kasi nagda-diet po ako.
Okay, nag-exercise. May I ask how was your day today?
Hindi po maganda, nurse, kasi masakit po yung ulo ko.
When it comes to your family, how are they?
Okay naman sila except kay mama at papa kasi si papa may migraine, tapos si mama may hypertension.
Okay.
Apo.
Okay. So let's proceed to your usual cycle. What is your menstrual cycle po?
28 to 30 days.
28 to 30 days. How long does your menstrual flow occur po?
3 to 4 days.
3 to 4 days. How many pads do you consume every menstruation?
5 po.
5 pads. Okay, so now let's get your vital signs. May I know your height and weight?
Apo. Yung height ko po is 150 cm.
150.
Tapos yung weight ko po ay 52.
52. Okay, let's get your BP, ma'am. Okay po. Tanggalin po natin yung jacket, ma'am. Okay. Relax lang po tayo, ma'am, ha? Okay. Heart rate naman po. Okay. So, temperature naman po tayo, Miss Kaina. Okay, insert ko po, ma'am. Heat it. While waiting, kunin ko po yung pulse rate niyo, ma'am. Okay. Wait lang. Okay, so do you have any question po, any clarification, any concern before we end this interview?
Ano po?
Okay, wala na. Okay, so thank you very much, ma'am. Thank you for your cooperation. Just wait there, okay? Just wait for your name to be called. I'll get back to you later. Thank you, ma'am.